Hi, I'm Dr. Kelly Starrett, Human Performance Advisor for H-Wave. When we're addressing issues around the wrist or the hand, oftentimes athletes and people forget that there is a gigantic movement system attached to this fine motor unit. Specifically, I'm talking about being able to have access to the tissues and sort of the implications of a restricted or poorly functioning forearm and how that can increase or be a component of my wrist or hand pain. What's remarkable about the forearm is that it's really easy to have access to the entire thing, and all I need to do is have a sort of low table. I could put a towel down, I can make this soft. I've got 2 lacrosse balls taped together here. So these could be 2 tennis balls, they can be 2 squishy balls. The lacrosse balls are sort of perfectly suited for having enough give, but they're pretty cheap. We can go all the way up and get something super fancy like this Gemini that we make. But the idea is that I want to be able to realize that I can get a lot of input into this tissue system very easily. So there are a couple rules here. Number 1 is that I'm looking for any areas that might be particularly sensitive to compression. So that's a simple way of beginning this conversation. So as I roll out on this, notice I can roll with my arm and work on these tissues with my arm straight, or I can work in these positions with tissues with my arm bent. But the bottom line is I'm beginning an exploratory system. Flexion-related issues tend to be sort of on the bottom side of my arm and attach on the inside of my elbow with my palm is up. Extension-related issues tend to be on the top of the arm and related to more the outside of the elbow. So even if I'm having sort of more positional issues on the outside, notice that I can still just kind of tip my body over and still be able to access those extensors. Now, again, what I'm saying is that I'm starting to roll back and forth. I'm looking for areas that might be particularly sensitive. You know, I could make a stack of a couple of these if I wanted to or so inclined. And the bottom line is if I felt something that was painful to compression, I don't panic. That's the spot I'm trying to be curious about. And the easiest thing to do is to start by making an isometric contraction, which means I'm just going to flex my muscles into that area where I feel restricted. I'm going to hold that for 4 seconds, and then I'm going to relax and see if I can soften up and go a little bit deeper. That combination of creating an isometric contraction for 4 or 5 seconds and then relaxing and breathing out can go a long way to help desensitize this area, tell my brain it's okay, but also just restore how these tissues are articulating. When we talk to athletes and people about their wrist pain and hand pain and then do a little exploratory sort of investigation, very rarely do we run into people who've done any self-massage around the forearm. And it's amazing how much mobilization of, say, something like the calf that people do, and yet this is the analog upstream on the forearm, and there's very little input here because these tissues are so robust and they just don't bark at us very much. But if I'm having pain in this area, we should be thinking about the big drivers of the hand are clearly up in the forearm, sort of back of the forearm area. And it's almost like this is the marionette and these are the strings that are running that system. So there's a lot we can do to impact the functionality of the wrist and the hand just by working upstream. There's a couple other things that are useful here. Of course, I can always just kind of come in with a point trigger, but notice that my hand also moves. So I'm able to move from both sides of the system. So if I was at the end of the table, I could contract or I could move my hand down. I could find a sensitive spot and just spread my fingers out and take my wrist through a range of motion. That's basically tacking and flossing these tissues here. But the bottom line is if I just started by becoming curious and adding rotational movement of my hand, looking at what's going on, kind of mobilizing these areas, becoming curious about what's happening when I move my wrist around. If I find something that feels too sensitive to take a lot of compression, stop and drop in that contract, relax, those 4-second isometrics with 8 seconds of relaxing. Suddenly, if I spent 5 minutes working on my forearm, what you'll find is that we can actually enhance blood flow. We can enhance sort of movement. And really the game here are restoring our native ranges and freeing up how well these tissues articulate as a system, as a neighborhood. And so if we look at the number of sort of muscles and vital nerve kind of running through these systems, It's a pretty compact little area, and if it tends to get stiff or tends to get restricted, we see degradation of the whole system. And you can feel that for yourself. If I just squeeze my forearm and then try to move or extend, you'll see it's a little bit stiffer. So the idea is, how do we reduce stiffness? Well, let's spend 5 minutes working on the front side, back side. Again, you can become very creative about how you're getting in here. You can modulate your pressure, just getting the weight on top of it. And a little bit of input can go a long way toward making your wrist and hand feel a lot better.